47 years of age with history of breast cancer on the left side, picked up on a self-monthly breast exam. So she ended up getting a mastectomy on the left side, reconstruction with alloderm, which is cadaveric skin, from another patient, which has been washed off such that the body itself will not reject it. And then the following year in 2017, in April, she had what was reconstruction on the right side since she did not get a prophylactic mastectomy on the right. So as you will see on the right side, she has the implant relatively small because she has her own native breast tissue. I removed the mass at the lower part that was not looking healthy. And as you will see right here, she has scarring, and part of this is the scarpus fascia, but you can see the scar tissue. So I'm going to send this along with the capsule. So I'm very happy and content with how the whole dissection went. You can see the teardrop shape appearance of the implant. And so what I'm going to do is I'm going to go ahead and cut this capsule out, and we will see what it's going to show. This is from 2017, April 2017. Now, as you can see, just like many of the patients have said, they have had like a double hit, meaning they had, so I'm able to pull this, and then I'm going to go dissect right into this implant from 2017, done en bloc, the gold standard. So you can see how thin, small the capsule is. So which we have seen many times. Now, one thing I want to notice here is this is, cut this open here. So this is a capsule. Some areas so thin, some areas thick, and you can see, look at this fluid that's around. So if I go like this, remember this is not enough to send to cytology. But if I go like this, this is your gel bleed, and look at this slipperiness that's present. Now, one thing I want to show here is you can see some areas of clear. This is where, this is clearly what is a textured implant. Now, if I go take my DeBakey, and this is the problem with implants. If I go like this, this is the gel bleed. This is slowly leaching into the body, causing all the problem. And this is that cause of what is breast implant illness. Now what I'm going to do is I'm going to just gently, using my fingers, I'm going to raise this, what is a secondary capsule off. I want to send this off to pathology. Again, always good. This is, remember, the textured implants have been banned. And actually hear this. So wherever you have the clear, so this is your Allergan. And I'm going to go ahead and just dab this here. 220, just like the patient said, and you can hear this. This is like, you know, if you will, literally like ginger. If you ever have sushi, this is what it looks like. And I'm going to send this all with this capsule, and I'm going to send this off as well so they can look at it. And again, as you will see, it has in it this fluid that leaches through. And this is all the badness that is present. So I'm going to go ahead and change my gloves. Be right there. Please continue to focus. And then you have the other side, which is the mastectomy side. You have the big flat of tissue that has to go. She had what was a nipple sparing mastectomy, where they left the nipple and the breast tissue behind. So from an oncologic perspective, she certainly could still potentially have gotten breast cancer. And so as you will see here, this is, I wanted to go ahead and get not only the nipple areola, but the area above and inferior, because she's had a history. And if I turn this around, I don't want to leave this behind. So that's why I incorporated this much further up. And so as you will see, I tagged this with a stitch to orient. This is the left mastectomy scar. And as you will see, this is her native breast tissue. And if I go like this, they will make sure we will write history of breast cancer. And again, mass on the left side. Again, you can see the scar type of tissue that's present that I did not like. So I removed anything even remotely suspicious. So as you will see right here, this is the Allergan, which is the cadaveric skin, and you will see on the inside there was this coat indentation that was present. So what I'm going to do is just like what I've done before, I'm going to actually pinch on this right here, and actually let me go to an area that's not, that I'm going to able to go in without potentially hurting the implant. So here I am, and I go in. Allergan end block, the gold standard. Remember, these textured implants have been banned. So as I go in, small amount of fluid around the implant, you can see the shininess. And again, what you see here is the same pattern, 1, 2, 3. This is how they manufacture. Area wherever you have clear, that secondary capsule has not formed. So I'm going to do next is, just like I've done, look at all of this tissue. This is that, if I just go around, this is that gel bleed that's slowly leaching despite what isn't intact. Let me go ahead and show you right here. This is, this is the ruler. Let me go over here. You can see how thin this is. You can read the numbers, right? So no matter how thin the capsule is, it has to go. And as soon as you go in, you will see the imprints, right? And you will see, look at the consistency here. This is the cadaveric skin. You can actually see the hair follicles within the epiderm. This is again used to be another patient's skin. And so this is very routinely used. This was a one-step reconstruction. She didn't have tissue expanders. This was above the muscle. So you can see complete removal en bloc fashion. And what I want to do again here is I'm going to use my instrument right here. And like I have done before, I'm just going to go in. This is an intact implant. And actually you're going to use these scissors. Remember, this is blunt. And I'm going to be able to go in with the pointer up. And then I can actually hear it. So as I pull this open. Implants are not safe, be it textured, saline, or silicone. The textured implants have been banned, so it's clearly stated that textured implants, the inflammation is certainly much worse. But the BIALCL is also associated with not only silicone smooth, but saline implants too. So you can see how tightly adherent this is. And this was the whole intended purpose, so the implant doesn't move around. I'm going to stick this there. Look at this. Intact silicone implant above. Very super tightly adherent. So what I'm going to do here is the implants will be returned to the patient. So I want to send this off pathology. I'm going to go in here. Remember, this is like super glued to the textured nature of that implant. So what I'm going to do is almost done. We've seen this many times, especially with textured implants, and certainly with other implants as well. This is your 375 Allergan, just like the patient very well stated, teardrop appearance. So what I'm going to do is I'm just going to go ahead and put the ruler here to take some more pictures. So the implants will be returned to the patient. The capsules will be sent to pathology along with these secondary capsules. These small masses that were at the lower part, cultures for Arabic and Arabic fungal, no need for drains. She has a flat chest closure on the left. She has a normal good aesthetic closure on the right, just like any of the cosmetic patients. And there you have it. Implants are not safe. All foreign material, including alloderm, must be removed. She didn't have any Athabon or clips, surgical clips. And so we will get a complete analysis of this given the history of breast cancer on the left. And most importantly, we'll see how the patient bounces back from her many signs and symptoms of breast implant illness. The whole goal of the surgery is that entire end block must be done definitively, completely, sincerely, along with all inflamed tissue, such that the patient has that peace of mind that all of that capsular burden, inflammation burden, the toxic burden was removed, and the patient has no worries and she bounces back to a normal, good, speedy recovery minus these toxins. This is Dr. Khan, Executive Plastic Surgery.